Hi, this is Dr. Ben Young, and you are listening to episode 36, if you can believe it, of the Perio Patient Podcast, a podcast for my patients and their buddies and friends and even strangers who happen to have oral cavities. I promised last time I would talk about face masks, so let's get on with it. I've thought a lot about this topic, as I'm sure have all of you, because now we have to remember to put them on before walking into stores. The political climate also contributes to the face mask questions, and this is too bad, frankly. But let's, for a moment, put all that aside, which deals with the motivations of others, which frankly I can't completely know, nor do I really care to spend my time thinking about. Rather, I'd like to talk with you about practical things as regards to face masks as we average normal people are trying to live our lives. And the first thing I want you to know from me to frame my comments is this. We need experts, but we don't just need experts. In many ways, experts are overused. Where they are experts, for example, I think I'm an expert in periodontics, I can be of use in helping others in my specific area of expertise. More than this, to some extent, I have reasonable opinions, some of them coming out of my training, and these might be useful as well, but also they might be wrong. In other words, the more my opinions come out of the same information pool you can access for yourself, the less important it is that you rely on my opinions. One thing we are hearing a lot lately is that we should do what science tells us. This is silly, and you know it is as well as I do, because science isn't a person, and consensus in science isn't how science works. Discoveries in science come out of people stepping out of consensus and setting up experiments to see if they can push against what we automatically assume to be true. So, what do they really mean when they tell us we must follow science? Well, they mean we must follow experts. Again, people are experts in narrow areas of knowledge. When it comes to pandemics and running countries and the rest, there aren't a few experts anywhere who can do a better job managing all of this than people everywhere doing things that make sense. And in this sense, I trust more the judgment of the general citizenry than I do a few experts. I refer you back to my podcast reading of the Declaration of Independence, which I submit to you is the foundation for our system of health care. Which brings me back to the subject of face masks. Should everyone everywhere wear face masks in order to, what? Keep the virus from infecting people, even those who are wearing face masks? To help me answer this question, I've gone to one of my favorite sources for medical information, the Mayo Clinic and their website. One of the things I like about the Mayo Clinic, and if you get a chance to read about its history, I think it will inspire you as it has me, is that the Mayo Clinic practices team medicine. If you go to the Mayo Clinic, you will meet with experts from different departments who will evaluate you as a team and create a treatment plan that they may then provide you before you leave. In other words, it isn't a long drawn-out process. Its purpose is to move from diagnosis to treatment, even surgery if necessary, as quickly as possible, and do it in a comprehensive manner. So, I will link to this article on their website entitled COVID-19, How Much Protection Do Face Masks Offer? And now reading from that, I'll just select some sections. Can face masks help slow the spread of the coronavirus, also known as SARS-CoV-2? SARS means severe acute respiratory syndrome. that causes COVID-19. Yes, face masks combined with other preventive measures, such as frequent hand washing and social distancing, help slow the spread of the virus. So, why weren't face masks recommended at the start of the pandemic? At that time, experts didn't know the extent to which people with COVID-19 could spread the virus before symptoms appeared. Nor was it known that some people have COVID-19 but don't have any symptoms. Both groups can unknowingly spread the virus to others. These discoveries led public health groups to do an about-face on face masks. The World Health Organization and the U.S. Centers for Disease Control and Prevention, CDC, now include face masks in their recommendations for slowing the spread of the virus. The CDC recommends cloth face masks for the public and not the surgical and N95 masks needed by healthcare providers. And let me make a comment about groups who change their minds and institute public health measures they did not recommend at first. This is the way it works in the real world. As people learn, hopefully they will adapt and change their recommendations and not, as often happens, double down on whatever it is they said at first and keep back new information just because it wasn't what they said at first. Which also means that when I see people changing their opinions and recommendations, I should understand and deal with it without becoming upset. Later, when the dust settles, we can read in history books how perhaps it should have been done better, but this is unhelpful right now, in my unexpertise opinion. How do different types of masks work? Back to Mayo Clinic. We'll break it into three: surgical masks, N95 masks, and cloth masks. Under surgical masks, also called a medical mask, a surgical mask is a loose-fitting disposable mask that protects the wearer's nose and mouth from contact with droplets, splashes, and sprays that may contain germs. And let me just say personally, if I'm in the operating room, which I have been many times, it is partly to help the patient who is having the surgery from my droplets and splashes, not just the other way around. But it works both ways. A surgical mask also filters out large particles in the air. Now, viruses are extremely small particles. Surgical masks may protect others by reducing exposure to the saliva and respiratory secretions of the mask wearer, which is a good thing because bacteria and viruses can be concentrated in these fluids. At this time, the U.S. Food and Drug Administration has not approved any type of surgical mask specifically for protection against the coronavirus. But these masks may provide some protection when N95 masks are not available. Oh, another way to put this is if you can't have an N95 mask, would having no mask at all make any sense? No, really not. Even if it's of less protection, it still has some protection. It also means that you can wear surgical masks and end up getting the coronavirus. Now let's talk about N95 masks. Actually, an N95 is a type of respirator. An N95 mask offers more protection than a surgical mask does because it can filter out both large and small particles when the wearer inhales. As the name indicates, the mask is designed to block 95% of very small particles. Some N95 masks have valves that make them easier to breathe through. With this type of mask, unfiltered air is released when the wearer exhales. So, understand, if the N95 masks stop 95% of small particles, it means it cannot stop all small particles. How many viruses does it take to make someone sick? Well, theoretically just one. But if I breathe in a single coronavirus, does this mean I will get sick? No, it does not. It is contagious, but apparently not that contagious. Not every virus hits its mark, meaning it finds a susceptible cell to enter in the body and reproduce itself, making more viruses that then repeat the process until the person does become sick. Some N95 masks, and even some cloth masks, as has been mentioned above, have one-way valves that make them easier to breathe through exhaling. But because the valve releases unfiltered air when the wearer breathes out, this type of mask does not prevent the wearer from spreading the virus. So they're not often recommended. In fact, I don't think they're recommended. A cloth mask is intended to trap droplets that are released when the wearer talks, coughs, or sneezes. Asking everyone to wear cloth masks can help reduce the spread of the virus by people who have COVID-19 but don't realize it. Cloth face coverings are most likely to reduce the spread of the COVID-19 virus when they are widely used by people in public settings, because then theoretically you have a few people who are infected with COVID-19 and don't know it. And countries that required face masks, testing, isolation, and social distancing early in the pandemic have successfully slowed the spread of the virus. So, finally, what is meant by slowing the spread? It isn't reducing the spread. In other words, the virus will continue to spread, and people who get the virus may not have done anything wrong. In some instances, it might be able to be shown that they were near someone else who was infected. However, most of the time, they probably will not be able to see this. People who are sick should isolate, and people who have been around people who are sick should also isolate and also be tested. Eventually, and most likely, unless there is a successful vaccine, and by successful I mean it's been proven that it worked, which is a long time from the time it was given, a vast majority of the population will come in contact with the coronavirus. At some point, this will mean that there are fewer people remaining in the population available to the virus to reproduce itself and be passed on to other susceptible hosts. In other words, just like other viruses we deal with, COVID-19 will burn itself out. This does not mean it will disappear completely. It will likely be found in new patients who become sick from it for years to come. However, it will never again cause a pandemic or an epidemic. And just because it won't cause a pandemic, it does not obviously mean we will not experience such a thing again with other viruses. Hopefully, we will have learned a lot from this one and will not make similar mistakes. But trust me, we will make new mistakes with the next one. That's the way life is. We're not ever going to get it perfect. So, when we cannot social distance, and because this virus is pretty highly infectious, we ought to wear our masks. It offers some, but not complete protection. This is as good as it's going to be. And if this isn't good enough, then whoever doesn't want this level of risk should not be in the public. If you're going in and out of places where you may come close to others, it is reasonable to just keep your mask on. So, I'm not personally upset seeing people outside wearing masks. I do it myself. They have their reasons, and it isn't my problem, so I'm not upset. If you are walking in a park by yourself or with family members where you share the same germs, essentially, then there is no reason I can think of to wear a mask. In fact, it is actually healthier not to have something over your face that has germs on it when outside in fresh air. And that's it for masks as far as I'm concerned. Thanks for listening. This has been the Perio Patient Podcast, and you have a great day. Oh, and before I go, shout out to those listening to me in Canada, Spain, Belgium, Ireland, Norway, Taiwan, and Australia. You're too far away to come and see me as a patient, but I hope what I have to say is of use to you there. All the best. Bye. I tried to catch some fog, but I missed.